Hello, I am the second to last presenter, so thank you so much for hanging on. I'd like to thank the organizers for letting me talk a little bit about the work that we've done. As you know, the World Health Organization projects that stroke will account for the highest percentage of disability-adjusted life years worldwide by 2030, and that low and middle income countries have the highest burden of stroke, accounting for 85% of stroke deaths annually. Now, Vietnam is classified by the World Bank as a low and middle income country, and it is undergoing currently an economic transition, which is accompanied by an epidemiologic transition that you all heard Peter Esselman this morning talk about, and earlier June Hanks also referred to, in which the epidemiologic transition is reflected by a disease burden that has previously been reflective of infectious diseases, but that now is really much more reflective of non-communicable diseases. And we know that stroke is one of those major diseases in the non-communicable category that really accounts for this burden. So with that in mind, we conducted a hospital-based study of stroke to understand more about the mortality and the disability among those who survived. So our study was in Vietnam, and just to give you a sort of a orientation of where that is, Da Nang is essentially in the middle part of the country, equidistant from Hanoi and Ho Chi Minh City. It was where the U.S. Army base had its base during the Vietnam War. The Vietnamese called it the American War, and it was where the U.S. soldiers took a lot of their R&R. And it was famous for China Beach, which you now know is a misnomer, the Vietnam Beach. We enrolled over 700 patients over a year, and we collected data on demographics, clinical characteristics, but we also measured disability and asked them about their disability before their stroke, and then measured it at admission and at discharge and at 28 days. And in the poster outside, you'll see that the age of our patients is about 65, the mean age, which is really younger than what we expect here and what we see at Harborview, and that the percentage of hemorrhagic strokes is higher in Vietnam for whatever reason. You'll see in the poster that the disability before stroke was heavily skewed, and so the majority of people were independent without any disability, and at discharge in 28 days, you'll see a very dramatic shift to those who are severely disabled. It's very interesting also that we observed that 7% died in the hospital, but an additional 30% were so gravely sick that they were discharged to die at home. And that's equivalent to what we do here in the U.S., which is called withdrawal of life support. And anecdotally, in Vietnam, there's a cultural practice where we believe that it's really best to die at home and not elsewhere, because there's a belief that the spirit has trouble finding its way back home. And so among those who survived, nearly 2/3 were moderately to severely disabled. And by 28 days post-stroke, we saw that 3/4 had no improvement whatsoever, and that 7% had deteriorated. So Vietnam is currently sort of at the forefront of the stroke epidemic, and we expect that over time, Vietnam, with the increase in economics, these will expect a lower mortality, and so that means that we will expect an increase of the number of survivors, and most, if not all of those people, will be moderately to severely disabled. There are no rehabilitation programs in Vietnam currently, and so the development of such programs would really greatly help these people, and as well as people in other low-income countries around the world. Thanks very much.